Thank you for tuning in to this episode of the Oswego Alumni Podcast. The views and opinions expressed in this episode are those of the guest and do not necessarily reflect the views of the Oswego Alumni Association, SUNY Oswego, or any of its officials. Email us with guest ideas or any other feedback at alumni@oswego.edu.
Welcome to the Oswego Alumni Podcast. I'm your host, Dee Perkins. Today, we're talking with Dr. Thomas Mahl, class of 1980. Dr. Mahl is the chief gastroenterologist and clinical professor of medicine at Erie County Medical Center. He graduated SUNY Oswego with a BS and then went to get his MD at University of Buffalo and then did his internships and residency in Connecticut. He eventually got a fellowship at Yale University, and he's the first Ivy Leaguer we've talked to on the podcast, so that's exciting. And currently he is in Buffalo, not only working with patients, but he's teaching as well. Dr. Mahl, it's really an honor to talk to you.
It is my pleasure to be with you, Dee.
So first up, we know you're in Buffalo. What's with the San Francisco thing behind you?
You know, it's the only filter that my phone loads. Otherwise, you get to see my bedroom, and we'll see that the bed may or may not be made. But I've stood at that spot in San Francisco.
Wow.
And so I thought it was appropriate. And I'm a little too computer phobic and naive to take a picture out the window and somehow get it into my Zoom. So that's as good as I can do.
Tonawanda, not pretty today. Neither is Syracuse, right?
No, Tonawanda and Oswego and Syracuse, I would say from mid-May to mid-October are they're so beautiful. But we have not had sun in, I think they said 17 days.
Wow. Oh, that's tough. That is really tough.
Yeah, well, it's the lake.
I am so excited to talk to you about medicine. When we talk with my group about who we're going to talk to, someone said, would you like to talk to a gastroenterologist? I said, would I? I am a huge fan of the TV show. The Resident is my favorite show. And I tease my husband saying that I know a lot about being a doctor because of that show. I know it's not true. I absolutely know it's not true. But I was going to ask you, do you ever see any of the doctor shows on TV? Do you ever have time?
I typically deal with it enough at work, so I don't spend time now. All my friends are watching those parasite shows and all those weird things, but no, I don't spend. There's a lot of drama in the hospital, so I don't do that. When I was in medical school, we watched a program called St. Elsewhere's, which was, it was a great show. And it was interesting because the producers were from Buffalo. Actually, the producer was from Buffalo and his brother was a famous surgeon in Buffalo. But they would say, I'll meet you at No Names. Well, I could look out my apartment window and see No Names. They said, well, no, let's go to Mr. Goodbar. And Goodbar was just down the street. So it was very worked on your head quite a bit. And not only have the medical thing, but it also taking place theoretically in front of your eyes.
So you grew up in Buffalo and your dad was a broadcaster. What brought you to Oswego and to a medical career?
I mean, that's a very good question, and one I have thought about. So I was not a sophisticated high school student by any means. I probably had ADHD or ADD and finished high school with a solid 72 average. I don't know if I'd ever read a book all the way through. However, I tested well, and so I won a Regents scholarship, which gave you admission, and I think free tuition was like $400 a semester back then to any SUNY school. And so the segue is my brother went to Oswego. My brother was interested in meteorology, probably because my father was not a meteorologist. He was an entertainer. He was talent, as they call it. But my brother's very interested in meteorology and came to Oswego and lasted 2 weeks. He was diagnosed with type 1 diabetes and ended up in the ICU. And my younger brother started having seizures at that time, and my father had a heart attack. So it's all this confluence of medical issues around during my formative years. And I had in the very back of my mind, well, maybe I could do some doctoring. And I would look at my grades and say, I don't think that's going to happen. But I did go to Oswego because I was a legacy there. My brother was there, and I thought it was the right distance for me, and it was free. And I suppose that's a little disappointing, but that is the truth. I was insufficient. I hear about people they go to counselors to learn what college to apply to, and all these different things. For me, it was much more haphazard. And happily, I landed there on the lake and had a wonderful 4 years.
So you didn't know right away that you wanted to be a doctor, but you did get your BS. So at some point, you must have shifted, and the grades too. The grades must have picked up. Yes.
Oh yeah. Even when probably through my junior year, I didn't know if I was going to do chemistry, go on for a PhD in chemistry, or if I was going to go to medical school. When I went to Oswego, there was a small pre-med group, and I joined that. I also joined SAVAC, the Student Volunteer Ambulance Organization, got my EMT, and every summer I came back to Buffalo. I would work as an EMT over the summer for a local ambulance group. So I was still undecided, but I did very much better. I was able, and I don't know the psychiatric epiphany that I had that changed me, but I was able, quite unlike high school, I was able to discipline myself and got good grades.
And you went back to Buffalo and got into medical school, which again is really tough. People drop out, people don't make it. And somehow you must have risen to the challenge.
Yes, and I did very well in medical school also. Something that kind of shocked me after looking at my more juvenile past. Again, and I think Oswego taught me discipline and taught me how to study. And I studied a lot, and I studied privately, and I kept shifting the rooms I would study in so I wouldn't get distracted as everyone's playing Frisbee out there. And and medical school is tough to get into. Sadly, I'm actually on the committee named the Student Progress Committee, and that's the committee that essentially has to discharge medical students from medical school because we've got certain very tough rules about staying in. So that is not a fun part of my job, but UB does a pretty darn good job, and we only lose a couple a year. They do a great job of selecting wonderful physicians of tomorrow.
And that has to be difficult. How can you predict how well someone's going to do in medical school? It must be an interior drive. For you, you had that emotional connection between your brother and your dad. You saw things going wrong, and maybe that fueled your fire, and maybe you look for that with students.
Certainly, but it is tough. And sadly, we know doing poorly on the MCATs usually relates to doing poorly on the licensing exams. But everything else in between, it is a big mush. And we do what we call a holistic review of the applicant. So, who are they? Where did they grow up? Did they grow up on a farm? Or did they grow up the sons and daughters of physicians in East Amherst? My kids' high school, there was probably more hepatologist, hematologist, gynecologist parents in that school than the rest of the county. So success coming from that background is easier than success coming from the inner city, where you have many fewer resources. So we look at those things, and we look at their personal statement, and we look at what they've done too. If when I would interview students, I would, so I'll say, what did you do last year? Well, I walked around Europe. And I'm like, well, that's fantastic. Who paid for it? And their parents paid for it.
Of course.
Of course. I have to say, I never had the opportunity to walk around Europe. And so things, if they said I worked as an EMT, or I worked as a pharmacy technician, or I worked at the homeless shelter, those things show a real dedication to humanity, and a dedication to medicine, rather than I snowboard all winter in Vail. That's just a sign of affluence, and I don't think we need any more affluent doctors. That's for sure.
Gastroenterology, back in the 80s and the 90s, I don't think a lot of people heard of that field. It wasn't really popular. Today, we're hearing commercials all the time about different, GERD and irritable bowel. And I know you specialize in liver disease. What drew you to that area of practice?
It was mentors. When I was in medical school, the dean of students, his name was Leonard Katz. He was the first GI fellow at Yale. When he only had one mentor, Howard Spiro, and I saw that guy as a outstanding physician. Just the way he talked to patients, just the way he did things, and I said, you say, I want to be a little bit like him. In another course, Albert Recate, a cardiologist at the University of Connecticut, Jim Freston, a legendary gastroenterologist, who are all good people, and our mentors. And I changed my mind. I thought when I went to medical school, I'd do trauma, because I'd come from an EMT background, and then I thought, you fall in with an EMT guy and you thought, oh, this is so cool, the little tiny bones in the ear. And then you just kind of move your way along. But for me, it was mentors. And when I got to Yale, I fell in with the liver guys. The liver and the gut guys at Yale, at least back then, were not on too friendly terms. And so they were kind of always bidding for fellows. Come on, be a liver fellow, and we'll throw stones at the gut guy. So, but yeah, I think it's mentors.
What was it in the mentors that made you want to be like them? What was that particular characteristic in their personhood that you said, that's the kind of guy I want to be?
Yeah, I think a certain calmness and competence. Calmness and confidence that rubbed off on the patient. No, I've been in an operating room where the surgeons are yelling at the anesthesiologist, and the anesthesiologists are yelling back. And maybe, again, that's because of their trauma background and the expediency of things. But for me, it was, and maybe I emulated that and projected that onto myself. I wanted to be more calm. I wanted to be more compassionate. But I can remember Len Katz and Jim Preston and Adrian Rubin, my mentors along the way, who are calm, compassionate, and brilliant men.
So this week, NBC News reported that we're seeing more liver issues with young women who may be drinking because of the pandemic, or it may be, we don't even know, but they're seeing more liver issues, more hepatitis, those kinds of things. Is that something you're seeing? And if you are, what can you tell us healthy people about better ways to take care of our livers?
It is a mini plague, alcoholic liver disease. Admissions for alcoholic hepatitis as of last year were up 58%. And this is a devastating disease that probably carries off 25% of people. Liver disease, when I was training, alcoholic liver disease in particular, was a disease of 50-year-olds. Now it's a disease of 30-year-olds. I buried a 24-year-old woman who died of alcoholic liver disease. It's everywhere. We have lists in the hospital of decompensated cirrhotics, and they're usually alcoholic. We now have these miracle drugs for hepatitis C and miracle drugs for hepatitis B. I have filled so many cemeteries with these people, and now it's just like, oh, just take this one pill a day for 8 weeks and you'll be cured. And even omeprazole, Prilosec. I lived when there was none of that treatment for heartburn, and people had the worst esophagitis, terrible, terrible lives. And the biologic treatments, Humira, you see them for Crohn's disease. So gastroenterology has had a wonderful rebirth, and we're able to do so much more. But in alcoholic liver disease, we have a very small armamentarium. And of course, the underlying problem is alcohol, and in the stress in society that's led people, I mean, completely bored at home for days at a time. Of course, people are going to want a drink just to calm their mind down a little bit. So we're seeing it all the time. And the truth is, this many people get transplanted. You know, if you're an alcoholic, people aren't going to give you a new liver until you can prove that you can stay away from alcohol for 6 months. And of course, people with liver disease are much more overrepresented in the field of mental health issues. So it's hard to get, hard to convince people. I tell the medical students in my lecture about alcoholic liver disease, and I say, alcoholic liver disease is alcoholism, alcohol use disorder, the better term, is an Egyptian disease. And they look at me. I say, yes, it's an Egyptian disease. And they're like, it's a disease of denial. Thank you. Thank you. Thank you. So it is, now in alcohol, there are some new drugs out that can help people stop, but it's a plague. It's like my third plague. The first plague, and I'm diverting now, and I shouldn't be talking as much.
Oh no, this is what you're here for. Keep talking.
At the brand new Erie County Medical Center, where I am now, I spent 29 years of my career at the Buffalo VA as chief of gastroenterology, chief of staff, chief of medicine, all the academic jobs, and it was a wonderful job. But I retired there with my federal pension and moved over to just another academic hospital. So I have fellows and medical students and residents and all these folks hanging around. Well, in the years past, I was a medical student there, and ECMC has a jail ward. I mean, with the bars and the guards everywhere, because prisoners have Crohn's and cirrhosis, and they have their issues, so they bring them in. And when I was a medical student, I went in there with another medical student into the jail. His name was Mark Nigagosian, and we saw a wasted man in a wheelchair with these spots all over him, especially on his shins. And we biopsied one, numb it up, put this little tool on there, take a little chunk, and the pathologist comes back and says, this is Kaposi sarcoma. It's usually seen in elderly men in Sicily. Then the papers start coming out. There's this new disease called HTLV3, and it's associated with Kaposi sarcoma and wasting and diarrhea. And then they renamed HTLV3 the AIDS virus. Oh. And so my first plague was HIV. And man, one reason I didn't go into pediatrics, it's dealing, most kids are completely healthy, but some kids aren't healthy, and emotionally dealing with that, I thought would be tough on me. COVID, has a tendency, God bless them, not God bless them, but has a tendency to carry off the elderly and the sick. HIV just went right down the middle of society and killed so many wonderful young people. It was terrible, terrible, terrible. I'm not looking forward to any more of those.
You said you were about to say that there were two other plagues, so that's one of them.
Well, then COVID, and now I would say kind of a mini plague of alcoholic liver disease.
Wow. Fatty liver disease, that is a different thing, right?
So they actually are very similar, but one's caused by alcohol, very simple biochemistry. The metabolism of alcohol leads to fat in the liver, and then fat leads to trouble. The other is caused typically by insulin resistance, being overweight, also associated with heart disease, high blood pressure, elevated cholesterol. Different biologic mechanisms lead to fat in the liver in that case, and then they kind of act the same. So there's non-alcoholic fatty liver disease, of which might be the fourth plague. There's if you stop people on the street and say, hey, let me ultrasound your liver, you come away in some populations, we have 60% have fatty liver. And if even 5% of those go on to cirrhosis, boy, we got trouble.
And most people aren't getting the blood test that is the first marker towards fatty liver disease, right?
Right.
Yeah. And then, for those that do find out, there are no symptoms. That's nothing. There are no symptoms whatsoever.
No symptoms until it's too late.
The other thing we're hearing about on TV a lot, IBS, Crohn's disease, IBS-D, IBS-C. Are you seeing a lot of that in your practice?
We do see, we're not a big Crohn's and ulcerative colitis place. We see our share though. And 3 days ago, we sent someone to the operating room, couldn't get them better medically with all the drugs, even the Skyrizi and all the things you see on TV. And they needed a part of their bowel removed and sewn back together. And I think we have another patient that he's got so much scar tissue in his Crohn's, despite all the medications that we have him on. We're going to have to take him to the OR, and I think they're going to do that Saturday to take out the worst chunk and give him some more time before he scars down again.
Are you still doing surgery?
No, thank God for the patients. No, I do procedures. I look into people's stomachs. I look into people's colons and band off hemorrhoids and take off polyps and cauterize ulcers. One of the favorite things to do, because we are a safety net hospital here, we also have 140 psych beds at the Erie County Medical Center, the only psych beds in the county. We also do all the prisoner work. So we have the pleasure of, in fact, I just have a paper in manuscript form that I haven't even gotten a chance to take a look at. We get swallowers. So people who take apart their pen, swallow a AA battery, swallow razor blades, swallow wires from the wall. I had one guy who crushed up his glasses and swallowed his glasses. And we couldn't get that out. We had to take him to the OR.
Wow. That's
that's kind of unique to this hospital, but it gave us the opportunity for one of the fellows to write up some case reports and a review of the literature. We had one recently that this guy's going to become a fellow. He's a resident and applied for fellowship. He got it, but he wrote this, just an abstract. It's not even a paper. We had this guy in the emergency room, said he'd never had a toothpick out of his mouth for 40 years. He swallowed a toothpick, and on CT, it was jabbed right into his pancreas. So we got the scan of that. We go down, we put a loop around the toothpick, we pull it out, we take a picture of some pancreatic juice coming out, and then we put it on the operation table, take a picture of that. We won an award because at the meetings, there's so much depressing news. To have a man with a toothpick in his pancreas was really kind of exciting. So not great scholarship, but a little bit of reaction formation and fun.
Before I move on to your teaching, because I do want to get to that, back to the liver, since you see all these cases all day long, how do you make sure that you take care of your liver? How should I make sure I take care of my liver?
So alcohol in large quantities is a problem. But I think everyone agree, for a man, 2 drinks a day is not a problem. There seems to be a threshold. And maybe even 2 drinks a day of alcohol. Now, I'm not talking a swimming pool size beer, but small amounts of alcohol are good for cardiovascular health. So being a teetotaler is not necessarily necessary, but men 2 a day, women it might be only 1 a day. And my patients always ask, can I save them up? So can I have 14 beers during the Bills game? And I said, no, you can't. The data's not great. 5 a day in men is a cirrhotic dose. Even at that dose, though, most will not develop cirrhosis. At the VA cooperative study of alcoholic hepatitis, the average person who had alcoholic hepatitis was drinking 25 drinks a day.
Whoa.
So that's really athletic drinking. And one of the problems of becoming sober is, what do you do with all that time? Again, women seem to be a little more sensitive, and maybe 1 drink a day. Now, what else you can do is stay thin. The dad bod, classic dad bod, where the guy's got the big gut and a smaller butt, that actually translates to what we call mesenteric fat. There's not a lot of fat under the skin, but there's a lot of fat around the guts. And that behaves different than other fat. And that sends off some of those signals that make you insulin resistant, give you diabetes, give you fatty liver, give you hardening of the arteries. So I think that's like a fashion model statement. You can never be too thin, but losing weight through diet and exercise, and of course, there's all these new diet things that are coming out, are effective ways of helping your liver. For example, if you have a fatty liver from being overweight and you go for bariatric surgery, I hate to tell people, but diet and exercise almost never works. Almost never. If you're 350 pounds, it will never work. You need bariatric surgery. And within a couple months, their fatty liver has gone away. So,
but sometimes they gain the weight back, regardless of the bariatrics. So,
yeah, but not that much. I mean, I've seen 400 pounders go down to 200 pounders, and that's good enough to make them non-diabetic, non-fatty liver, non-hypertensive, and looking forward to a better life.
Mm-hmm. So you won awards for teaching, and I totally get why, because you're very entertaining to listen to. The Segal Award for teaching, 2001, 2005, 2010. What keeps you going back to the classroom?
Well, I suppose I got that history of my father being a radio and television announcer with a mellifluous baritone voice. Maybe I just want to hear my own voice, but I know. So, and it's the rewards you get from the students who say those kind of things. And there is methods out there. When I came back to the University of Buffalo from Yale in 1990, I took a seminar on how to give a lecture. And one of those things was they taught you modulate your voice so you're not always talking in a monotone, and walk around the room and point to people and move and gesticulate. And kind of my famous thing is, well, one thing is no one's got more than a 45-minute attention span. So although I give a lecture to PA students who are really brutalized, this lecture is 3.5 hours long. And I'm like, how could you do it? So I break up, every 5 minutes there's a joke slide. The current ones, Trump slides, used to be Hillary slides, disease of denial. It keeps kids awake. And I call them kids, they're medical students. Most of them are zooming into the lectures, but so if you want to become a good lecturer, all you have to do, take a seminar on how to give a good lecture and practice it. When I was young, I would practice then we use slides. I would sit my 4-year-old or my 5-year-old and my 3-year-old down and my ex-wife, who I met at Oswego and Hart Hall, and I would go through my lectures, and my wife would comment on tempo and things like that, and my kids would just be entertainment. So, yeah, practice on who you have available.
Back in 1980, we never had the internet. We didn't have AOL dial-up. If you took a computer class that had something to do with cards, which I didn't even have to take when I was there, do the students blow you away in the classroom knowing what they know because the internet and all the answers, maybe some of them are wrong, but all of the answers are kind of out there already?
It's tremendous. And I tell the medical students, don't memorize the dose of Nadolol. Look it up. You naturally memorize some drugs, but don't memorize these things, because you can this stuff. Concentrate on listening to patients. There are some fabulous lectures out there. Fabulous lectures that there's one guy at UB that he's an anatomist. And I almost fell over because UB hired him only to teach. Of course, most non-physician professors at a medical school have PhDs, and they're expected to get grants. So this guy, instead of getting grants, he's on salary, and he did a 10-minute video that has gotten hundreds of thousands of views on the anatomical snuff box. There's a little triangle here right between your thumb, your first finger, tendons, and all sorts of things. And he said it took him several days to put this together with the arrows coming in. I wish I had that time. As a clinician, yesterday we scoped 12 patients, and then we had 3 emergencies on top of that. It gets for a busy day. But there is great stuff out there, great stuff. And it really intimidates me because I can't do it. We go into small group, and then someone does something, then their slides are up on the screen, and they say, "Oh, it's Blackboard, and we're going for." I'm like, man, too much for my little brain.
The learning that you got from your dad on how to be a personality, whether you learned it intentionally or not, has actually, though, paid off really well, because it makes you a better lecturer.
Thank you. And I think it makes it more enjoyable too.
My last question is always the Oscar speech. If you were being handed an Oscar today, who at Oswego would you thank for getting you to where you are today?
I think probably the chairman of the Department of Chemistry, Gus Silveira. Another one of those guys, calm, confident, brilliant. There's another guy, organic chemistry, Pearl Monroe. The band director, George Coopernell. I was in the band for, I think, 3.5 years. I couldn't. So those are kind of the professors, but I can't really forget my roommates. And that going to college is when you meet other people, and intimately you're sharing a room with them, and you learn a little bit about this. Dave Parker was an anarchist, and he taught me a lot of things. Pete Snyder, Chris Miller, my roommate for many years, who now is an actuarius, Patrick Henry. So like those mentors in medical school and college, you take a little piece of Patrick Henry and David Parker with you too, and that expands the way. And I don't know if that could happen now, because everyone get into fistfights, but actually people would listen to argument back then and say, well, maybe that's true, and maybe let me think about that. So yeah, I think a combo of my roomies, and of course I met my wife there, and we were married for 30 years, and then the chemistry folks, Gus Silveira, Pearl Monroe, and the band director, George Coopernell. Good people.
I said that was going to be my last question, but I lied. I forgot to ask you, one of the things that you continue to do throughout your years away from the college is support the college in many different ways. Why is it important to you to still be there for, a college that, you left 50 years ago?
Well, I'll tell you exactly. Although my father was a broadcaster, which sounds expensive, he also was a real alcoholic. And so he was often unemployed. And so, I mean, going into the weekend, if I had $3, I felt I was the luckiest man in the world. And when I would come home for Christmas, I'd get a job busting dishes. I'd get a job at the ambulance corps, anything to make money so I could go to college. So I know how it can be a struggle for folks. And truthfully, gastroenterologists are well paid, and I have the opportunity to give back, and it gives me great pleasure to help support folks that may have been in my situation in the past, or to support unique things for them. Summer research scholarships. I could never have done that because I had to work at the ambulance. But that might have pushed me to a PhD in boron chemistry or whatever. Giving to that program and scholarship, the general funds, allows me just to help people that may need help.
That's amazing. What an answer. Well, listen, I know how busy you are. It really means so much to me that you took the time for us today, Dr. Mahl. You can find him at the Erie County Medical Center in Buffalo. I looked, he's not a big guy on social media, but as we've discussed, he's a teacher and a doctor. So I really want to plead with you, do not spend any time on social media, okay?
And if any of you want to email me, my email is tmahl, M-A-H-L, at ecmc.edu. My University of Buffalo email is less flexible. So tmahl, M-A-H-L, at ecmc, Erie County Medical Center.edu.
That's awesome. And for anyone who's watching today, if you want to reach out to us with guest ideas, we are on social media. We're on Facebook and LinkedIn, and you can also email us at alumni@oswego.edu. I'm Dee Perkins. Thanks for joining us for the Oswego Alumni Podcast.